Hello, my name is Patrice, and I am doing a NG tube insertion for Adult Health 1, Term 2 with Professor Owens and Sink. So before I begin my procedure, it's always standard protocol to check the physician's orders against the MAR to make sure that this is the right person, this is the right procedure for that person, to ensure the type of tube. In this case, we'll be using a Salem sump, as well as why we're actually using this NG tube, whether it's for suctioning or for feeding. And with that information, I will gather my materials as I have and go to the patient's room to tell him that the physician has ordered that he has a NG tube placement, why he's having this placement. In this case for today, we'll be doing it for suctioning, and to ask the patient, after I've done my two identifiers, to make sure that they don't have a history of allergies, and then we can go ahead and get started. So before I put on my clean gloves, I'm going to go ahead and assess my patient's nares as well as the oral cavity. And the reason I'm doing this is just to make sure that it's patent. There's no deviated septums, there's no occlusions blocking anything. And then at this point, I would ask him to occlude one of his nares, to take a deep breath and breathe in and out of the open nair, and do that again on the opposite side by occluding that nair and asking him to take another deep breath and breathe in and out to make sure both of those passageways are open. I would then ask the patient to open his mouth, check the oral cavity, and make sure there are no occlusions in there and the oral cavity looks fine. And so now I can go ahead and wash my hands and put on my gloves. And at this point, I can go ahead and remove my tubing from the bag, and I will begin to measure the tube so that it fits specifically for my patient. And the way that we measure to make sure that it fits is by taking the tip of the tube and putting it at the tip of the nose and going behind the ear all the way down to the xiphoid process. So we'll take the tip of the tube, tip of the nair, behind the ear, down past the xiphoid process. And for Mr. John Doe, that would be about 55. And we're going to go ahead and mark that so I know where to stop. And at this point, I can go ahead and take my lubricant, and I'm going to 4 inches at the distal end of this tube, go ahead and lubricate my tubing. Okay, and I'm going to go ahead and put my towel down just in case there's any nausea or vomiting for this for Mr. John Doe, and then I'll go ahead and tell him that the procedure is about to begin. At this point, I will ask him to lean his head back, and then I will begin inserting into his left nair as I go in. Okay, and at this point, I've got some of the tube in. I will go ahead and stop right here and check in the back of the throat to make sure that the coiling, there's no coiling in the back of the throat. Okay, I don't see any coiling. Okay, so then also, if Mr. John is coughing at this point, I can actually withdraw some of the tube and allow him to have a period of rest. And then once he has calmed down and stops coughing, I'll go ahead and give him his water and ask him to take a few sips while I further advance the tube down, and also ask him to place his head down while I advance that tube down. Okay, so my tubing is in, And temporarily, I'm going to go ahead and tape this to the side of his face, just temporarily, so I can check placement, and then I will anchor the tube on his nose. And so by checking placement, the first thing I'm going to do is ask Mr. John Doe to speak. So I'll ask him, Mr. John, could you please say a few words for me? Could you tell me hello? Could you tell me how you're feeling? Okay, so now I know Mr. John can speak, and then I'll ask him to open his mouth, and once again, check in the back of his throat to make sure that there isn't any coiling. And if this is hospital procedure policy, I will take my syringe and attach it to the end and suction back for gastric contents to test for the pH. And when doing that, we're going to make sure that we're noting the color consistency of the gastric contents, which should be a greenish brown. And after we've aspirated those gastric contents, before I reinsert them, I'm going to go ahead and put my stethoscope down in the gastric area. And when I reinsert, to check for placement, I should hear a swooshing sound once this goes back in. So I'm going to go ahead and do that. Okay, I hear the swooshing sound. Okay. Okay, I hear the swooshing sound. So at this point, I will also call and to further verify placement by getting a chest x-ray. And at that point, after I do that, I'm going to anchor this on his nose. And I'm going to do that by doing the butterfly method. I'm going to go ahead and the chevron, excuse me, not butterfly, but the chevron method. I'm going to take this and go ahead and anchor that on both sides. Okay. So now that that's anchored, I can also move this down, and I'm going to ask the patient to look away from me towards the right, to the opposite side on which I'm going to take and pin this. And I'm going to take my rubber band and my pin and secure this, and in order to get some good range of motion and he has some flexibility with the tubing so that it doesn't snatch out, I'm going to go ahead and have him look over and attach this and safety pin it on the side of his gown. Okay, so now I can actually hook this up to the low intermittent suction and allow that to be suctioning while he's waiting to go for his chest x-ray to reconfirm that placement. Now for documentation, I would document the time of insertion, the date of insertion, as well as the consistency, the odor, as well as the characteristics of the gastric content. In addition to that, I would make sure that I would note any drainage. I would take the intake and output form to notate the amount of drainage that came out of the tube, and any client teachings that I may have provided for him during this time. I will also document that in addition to his response to this particular procedure. And into my documentation, I would also include the NG tube size, the length, and also the type of NG tubes that I used, which was a Salem sump. And that officially concludes my documentation for NG tube insertion and irrigation. Thank you.